Hello, I'm JMV Hahirwabasenga. I'm working on a goal called research in healthcare. In a goal called conduct research and create article outline. I'm doing a research about affordable act care. That's why I'm with this person whom I'm about to interview. But before starting, I would like him to give me a consent. That's why I'm going to read this informed consent so as to get his consent to be interviewed. My name is JMV Hahirwabasenga. I'm a student in the Bachelor of Arts program with College for America at Southern New Hampshire University, and I'm conducting this interview as a part of my academic work. With your consent, I will record this interview and use the information in a video I'm working on for a goal research in healthcare project. The interview will be used to create a video and submit it to a College for America so that my project can be evaluated. This recording will be used solely for this purpose. The interview information will be temporarily stored in a College for America online evaluation system to which only the evaluator and College for America staff will have access. Do you have any question?
No.
Do you give your consent to be interviewed and recorded? If yes, you can read here.
So, I, Jean-Marie Vianney, give my informed consent to participate in this interview to be recorded and used as part of students' academic work.
So, thank you so much to give me your consent to be interviewed. So, here I have like many questions that I'm going to ask you.
Yeah.
Then you have to give me your answers regarding to the knowledge that you have about them. The first question says, what do you understand by Affordable Care Act?
So, thank you very much for the good question. Actually, the Affordable Care Act, it's a landmark health reform legislation passed by the 111th Congress and assigned into the law by the President Barack Obama in March 2010.
Thank you so much.
Yeah.
I really appreciate your answer.
Yeah.
That this Affordable Care Act, which is known as Affordable Care Act also, was established by President Barack Obama in 2010. So I would like to know the benefits behind establishing that Affordable Care Act in healthcare institutions.
So, thank you very much. Actually, the benefits in healthcare institutions include that doctors, like those people who are going to follow the patients, whether they are cured or not, they are going to be paid without maybe any circumstance. Like some people may get like a problem and they do not find fees for paying the doctor. So at that time, but when this Affordable Care Act is implemented, they will get the fees to be paid. So another importance is that the institutions will help the patient to cover mental health services where patient may be buried around $40 per session. So you understand that mental services was a complication before Affordable Care Act. So apart from that, the Affordable Care Act will intervene in different healthcare institution activities such as laboratory services, emergency services, hospitalization, pediatry, and maternity and newborn care.
Thank you so much. I like how you elaborate your answers, how the healthcare institutions benefited from the establishment of the Affordable Care Act. So I would like also to tell me the benefits that the Affordable Care Act brought to the population themselves, because you have just told me how the healthcare institutions was benefited. So now it's about the population themselves, how they benefited from this Affordable Care Act.
So the population will benefit from the Affordable Care Act, whereby the people with low level income will get like access to health services because Affordable Care Act offers this the help to the people with low level income so that they can get health services to the hospitals. That's like, for example, it is stated that citizens with household income between 100 and 400% of poverty are allowed to take subsidies of purchasing affordable coverage. So you understand, those people with low level income will be like assisted so that they can get medical services.
Thank you so much. And I understand that this Affordable Care Act will help the people just to get the a good healthcare quality.
Yeah.
So, but also the from question that one I want you to answer me state that what do you think can be added to the Affordable Care Act policies so as to make sure that all those institutions, all those people are getting the healthcare quality that they need?
So I think based on the services which are given by Affordable Care Services, so I think it's better that they can add the policy of taking care of children dental care services. So you understand that children care for dental services for children was a little bit difficult for some families. So if they add that service, it will be better that those families can get easily help and their children can be safe with that dental services given.
So thank you very much. Let's go on with the from question. It says, what are the differences in people's life standards after the establishment of Affordable Care Act in healthcare institutions?
So the Affordable Care Act is helping people with pre-existing conditions. So this is where the Affordable Care Act protects people from being denied health insurance. So this means that the Affordable Care Act gave the people to guarantee of their own period of time which the health insurance cannot give them. So another impact of Affordable Care is that it allows children up to 26 to stay on their parents' plan. So you understand, before the medical services was given to children who are like even lower than the age of 26, but now the Affordable Act included them. You understand?
Yeah. Okay, thanks so much. You've talked about many different reasons why Affordable Care Act was established, but I would like to know if there is other reason that you think Affordable Care Act was established.
Other reasons?
Yeah, why do you think Affordable Care Act was established?
So, according to my own understanding, so I think Affordable Care Act was established so that for big improvement in health services and for like mental health assistance to some people who were facing that problem, and discover the coverage which were low pace before establishment. So it's like it was established for the purpose of helping people who are struggling with mental problems.
Okay, thank you so much. If I understand you well, it means that it's established so as to change the medical decisions which were made, maybe wrongly, to turn into making it very, very.
Yeah, I have
good.
other reasons.
Okay.
So the other reason is that it was established so as to expand medical to the working poor income families. It was also established to change the way that medical decisions were made. So it was also established so as to reform private insurance market, especially for individual and small group purchases.
Okay, thank you so much. We are closing to the to an end of my search.
Yeah.
Where you were supposed to answer me several questions. So I mean, we've only one question, which is the last but not least. It says, what are the challenges and difficulties that are being faced by the employers of those big or small companies in the progress of Affordable Care Act in the United States of America.
So actually, Affordable Care Act was established by Obama, the former president of USA, and led to establishment of health saving accounts. So to the small business owner. So the purpose of those health saving account is to help people to pay the medical services with the deduction of tax, where the funds you pay into your account will be covering most of healthcare costs. So this became a challenge for those small business owners and the employees who were relying on the broken individual market because the health insurance is continuing to lose access and control over their healthcare dollars. So this is because every year the cost of the healthcare increases while the access of the care declines. So I think that was the difficulty.
Thank you so much for taking your time. I know you had many things to do.
Yeah,
So I think that if I need you again, you will come.
yeah, of course I will.
Okay, thank you so much.
Thank you.